Hello everybody. Welcome back to yet another episode of Beyond the Diagnosis. Okay, selamat petang semua dan selamat datang ke siri webinar kita Beyond the Diagnosis. So this is our second episode. Okay, so we have had our first episode about childhood cancer, and today we're going to talk about cancer payudara. Okay? All right, so we're going to talk about breast cancer today. All right, and thank you so much for being here with us today. So hari ni saya tak naklah cakap purely in English. Okay, so kita santai-santai sahaja. Okay, I will try to answer all your where, when, and how questions and why questions regarding breast cancer. If you have any questions, please do leave it at the comment section. Okay, boleh letak dekat comment box di sana. Okay, anda di stream dekat Facebook ke ataupun YouTube, boleh letak soalan anda di comment box. Okay, I will definitely try to answer all your questions by end of the session. All right, so I have a series of slides here. Okay, I will go through with you all and we will get to know more about breast cancer today. Okay, so let's go. All right. So, a little outline of today of what I want to talk about is saya nak bercakap lebih terangkan sikit tentang breast cancer. Okay, so we'll have a slight introduction section and then cancer statistics, and then definitely a lot about breast cancer and also some very important take-home messages. Okay, so for introduction, yes, my name is Dr. Rutresh Rao Subramanian. All right, so I am the health promotion lead and also medical officer in National Cancer Society Malaysia. All right, so I have experience, of course, definitely in pediatrics, and also I have experience in public health. All right, I have a very keen interest in oncology, which is cancer, and also I have very keen interest in community medicine. All right, so moving on. So let's talk about cancer. Okay, kenapa kita kena tahu pasal cancer ni ya? Alright. So kita perlu tahu statistik yang sekarang kita ada di Malaysia ya. Alright. So why we are trying to preach, kenapa kita nak bagi tahu audience kita, kenapa kita nak bagi tahu penonton yang cancer ni sangat berbahaya, and why we are trying to increase the number of screening. Okay. So the main reason is that incident of cancer in Malaysia have increased from 41,236 cases, new cases, we are talking about new cases from in 2015, and it has gone up to 48,639 new cases in 2020. All right. So we are expecting, kita rasa kita akan cecah 57,000 case baru by the time 2025 kalau tak ada apa-apa action yang kita ambil. Alright, so if we are not doing any awareness, if we are not doing anything about it, we will definitely reach about 57,000, and that's a very very alarming number. Alright, so ada satu study di tahun 2016 di mana insiden cancer adalah 3 hingga 4 daripada kalangan lelaki seramai 1,000 orang, and about in 4 to 5 women out of 1,000 women have cancer. All right, so this is something that is very 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 worrying. All right. Okay, so today why we are going to talk about breast cancer. Of course, kalau kita ambil bulan 10 ni, okay, tengok kanan, tengok kiri, everywhere people are talking about Pink October. Why? Because October is a month where we raise the awareness about breast cancer. Tapi bukanlah nak kata throughout the year jangan fikir pasal breast cancer. Alright, so you have to be concerned about it. But October is very special that in worldwide, in all organizations, especially healthcare related organization, kita memang nak bagi tahu yang kita nak preach pasal, we want to preach about cancer payudara. Alright, so this is the best month that we want to talk about it. So let's see what we have next. Alright, so statistics on breast cancer. Alright, so among women dekat Malaysia, untuk wanita, kita rasa kita ada statistik di mana we have a Malaysian National Cancer Registry that shows that from the year 2012 until 2016, among the cancers for women, breast cancer is the most commonest cancer. All right, and it didn't take count of race, religion, and age. Okay, so dekat sini saya nak bagi tahu dekat semua orang that breast cancer did not go by race or religion or age. All right, so every few seconds someone is being diagnosed with breast cancer, and also I want to definitely bagi tahu satu mitos okay, ramai lelaki yang sangat-sangat rasa yang diorang tidak boleh dapat kanser payudara. Okay, so men also get diagnosed with breast cancer. There are chances, there's about 5% chances, okay, of men to get diagnosed with breast cancer. And in Malaysia, we have diagnosed men with breast cancer, and there's definitely chances and risk di mana satu daripada 100 orang lelaki boleh dapat kanser payudara. Alright, so this is a myth that I want everyone to understand today. Alright. So moving on, all right. So in specific, of course, I've talked about the Malaysian Cancer Registry that breast cancer has the highest incidence of all women cancer, which is about 34%, and the others followed by colorectal, cervix, and also uterine cancer, and so on. All right. So yang breakdown yang kita nak bagi tahu is that the most common is that about one in every Malaysian woman, 1 in every 30 Chinese Malaysian women mesti ada chance or risk of developing cancer, and 1 in every 22 Indian women have chance of developing breast cancer. All right, and followed by 1 in 30 for Malay women. Okay, this is our statistics in Malaysia based on the cancer registry in 2019. All right. Okay, so why women in Malaysia present at later stages and larger tumor? Okay, kenapa? Okay, so I think it's very common kalau orang yang kita yang duduk dekat city, we are in urban or suburban area, I'm very sure that we have a little bit of knowledge about breast cancer. Sebab kalau saya rasa kita pergi tanya mana-mana makcik pun yang duduk dekat city area, kalau tanya dia pasal kanser payudara, they can give you some idea about it. Okay, maybe it's a lump. Okay, we are talking about ketulan ke, ataupun we are talking about some lesion or some luka ke, things like that. But if you go to rural areas and also up to a little bit further from these suburban areas, they always believe on a lot of they have these cultural beliefs, they have this alternative therapy beliefs. Bila dah dapat je satu ketulan, tak nak pergi jumpa doktor, terus nak pergi jumpa bomo lah, nak buat rawatan kampung lah. So this is something that we need to change in the mindset of people. Okay, so I was actually from Hospital Temerloh, which was considered one of the I would consider it as suburban to rural area, where we cover a lot of especially orang asli people. So dekat sana the cultural belief was very different, so they would not definitely come for any western medication or therapy. They would definitely go for alternative therapy. Okay, so this cultural belief is definitely something why women in Malaysia present at later stages and also larger tumors. Okay, and I think another important fact here is that Malaysian women sentiasa rasa takut, and another thing that people think is that bila ada lump je diorang rasa, oh okay, kalau pergi buat mammogram, kalau pergi buat breast ultrasound, benda tu adalah sakit. Okay, benda tu adalah something yang doctor will actually cocok at your payudara and then it will be very painful. No such thing. Actually, it's just a simple x-ray or an ultrasound. Okay, so these are things that we want to walk through today. All right. Okay, and also we have also noticed that deaths from breast cancer have dropped about 2% every year. And in Malaysia, we have noticed this since the year 2016, and that is actually thankful to our improved treatments and also increase in mammographic screening rate. Okay, if you notice that not only at National Cancer Society, banyak lagi NGO, banyak lagi hospital dan clinic are actually doing a very good job. They are actually trying to increase the mammographic screening rate and also trying to improvise on the early detection, and also appropriate treatment has always been given. All right, so that is the one of the good reasons why we have actually dropped the deaths from breast cancer. All right. Moving on, so how do you classify common breast cancer? So saya tak nak lah terus bagi tahu macam medical, very medical here, using jargon. So I just want you to understand two things here, okay? When it comes to carcinoma, okay, carcinoma is like the medical term for cancer, all right? So this medical term for cancer, we can divide into two, okay? Kita boleh panggil satu tu adalah in situ, alright, di mana breast cancer tu tak spread, okay, it's at the same spot. And another thing, we call it invasive. Alright, invasive mean it has already started spreading to other place. How do you know the difference is that kita ada satu sistem di badan kita, okay, we call it lymphatic system ataupun sistem noda limpa. So how does this system noda limpa works is that it would actually help in boosting your immune in your body. So what these cancer cells will do is that dia akan pergi attack dekat itu nodal limpa. Okay, nodal limpa, macam mana nak tahu kita ada nodal limpa ke tak? I think very commonly bila kita ada infection, kita batuk-batuk ke apakah, kita sentiasa rasa satu lump dekat kita punya armpit, ataupun kita boleh rasa satu lump dekat sini. Those are actually your lymph nodes working hard to actually try to fight against whatever infection. Similarly, for cancer, these lymph nodes would actually work hard to try to, fight against cancer. Alright, so what this cancer will do is that it will go and attack these lymph nodes. Bila dia pergi attack, that is how the cancer actually spreads to other places. Okay, that's when you hear a lot of stories about your family, di mana your family members ada yang datang bagi tahu, oh actually sekarang dia datang diagnose, initially dia kata stage 2, tapi sekarang tiba-tiba dah jadi stage 3, stage 4. How does that happen? That is because it becomes carcinoma invasive. That means it spreads through the lymphatic node lah. Alright, so that's how it actually spreads, and that's how kita panggil metastasis, and that's how it goes from your breast. It boleh pergi dekat your lungs, atau boleh pergi dekat your spine, can go to your brain as well. Alright, okay, so this is something that I want you all to understand about. Alright, so moving on, how do you stage breast cancer? So very commonly kita sering kali dengar, okay, kalau kita punya family ke friends ke whoever that gets cancer, we always hear this word, oh dia sekarang stage 1, stage 2, stage 3, stage 4. Okay, that is very common where kita try to bagi tahu, okay, kalau stage 0, 1, 2 and 3 dia tak spread, kalau stage 4 maksudnya dia dah spread and it's all over the body already. Okay, that's a very common thing I want you all to understand. But in terms of breast cancer, macam mana kita nak categorize dia adalah kita panggil kategori T, N dengan M. Alright, so T ada daripada T0 sampai T4, and N ada daripada N0 sampai N3, and M ada 0 dengan 1. Alright, so how do you categorize is that bila T dah sampai dekat 4, dia akan start affecting the N. So T adalah the size of the lump itself. Okay, N adalah di mana tadi macam saya cerita about the nodal limpa. If it start affecting your lymph nodes, that's when your N category starts activated. Alright, so bila dia start activated, dia akan pergi sampai 0 sampai 3. So bila dia dah sampai ke 3, and then it will start attacking your M. M is kita panggil metastasis, di mana bila dah ada N punya involvement, lymphnode punya involvement, dia dah start spread to your whole body. Okay, that's when we call it either M0 atau M1. Bila dah M1, that means it already start spreading to your body. Alright, so this is how we stage breast cancer lah. Alright, so what is the purpose that we actually do this staging is that kita nak tangkap breast cancer ni by doing early detection at the stage of T itself. Kita tak nak bagi dia pergi sampai N. Alright, kalau boleh kita nak tangkap bila dia dah dekat T1, T2 or T3. Even T4 also dah considered dangerous because bila dia dah dekat T4, dia akan start affect your lymph nodes. Bila dia dah affect your lymph nodes, nodal limpa tu, okay, that's when it already starts spreading to other place. And that time, their treatment options are also very limited, and also your survival rate is also limited. Okay, we will walk through that later in a while. Alright. Okay, so what are the risk factors? Okay, apakah risiko-risiko yang wanita di Malaysia ada? So, ada yang kita boleh kontrol, ada yang kita tak boleh kontrol. Okay, what are the uncontrollable risk factor is that, of course, being a woman itself. Okay, your gender is something that you cannot change. Biologically, you are born as a woman, alright? So, that is something that you cannot change. So, that's an uncontrollable risk factor. Okay, and getting old. Takkanlah tahun ni 16 tahun depan nak jadi 15 kan? Memang taklah. So kalau this year you're 16, you will grow older, and of course breast cancer is prominent over the age of 40. Alright? And also if you have a family history of breast cancer, that is also one of the risk factor for you to get breast cancer. Alright, this is memang something yang proven studies lah. Alright, and also ada studies yang dekat UK dengan US di mana dia kata yang breast cancer gene ni dia kita panggil BRCA1 dengan BRCA2. We can actually detect these genes in women di mana we can actually identify whether this woman will actually develop breast cancer ke tak. And it's actually a proven study dekat UK where they say that kalau ada presence of this gene BRCA1 dengan BRCA2, risiko untuk dapat breast cancer adalah daripada 40% hingga 85%. Okay, so this is something that you can keep into your mind. Alright, this is something that at early detection, kalau rasa kita ada family members yang you have a family member with cancer, maybe this genotyping genetic testing that is actually currently available in some private hospitals, you can actually do that to know whether you would actually have the risk of developing breast cancer or not. Okay, and also ada dua lagi risiko. Satu adalah early menstruation, bila dah datang haid sebelum umur 11 tahun, it's also a risk factor to develop breast cancer. And also bila dia menopause ataupun tamat haid tu lebih daripada 52 tahun. Ada juga wanita, especially Malaysian women, there are some who actually take a lot of hormonal supplements, okay, and they try to extend the menopausal punya timing atau age up until 60. Okay, that is actually considered dangerous. Okay, you are actually interrupting your hormonal balance, and what happens when you interrupt your hormonal balance, dia akan cause a lot of effects. Okay, these are things that would actually cause you to develop breast cancer in the future lah. Alright, so itu adalah satu lah. And another thing of course is your breast density lah. Bila naturally you have a denser breast, it is actually a risk to develop breast cancer. And of course if you have an history di mana you ada neoplastic disease, that means pernah ada lumps ke, pernah ada cyst ke, okay, there are actually chances for you to develop cancer. Okay, and another thing I nak bagi tahu dekat sini ya. So seringkali wanita dekat Malaysia ni dia rasa bila dapat cyst dia memang tak ada apa-apa sebab dia kantum air saja kan. Tetapi when you have one cyst and when you develop and that is already cured, and when you develop another cyst, tak semestinya cyst itu adalah bukan malignant ataupun bukan tumor. Okay, you have to definitely check it out. Okay, there are chances, of course chances of cyst untuk develop jadi cancer adalah sangat rendah. Tetapi bila you keep developing a new breast cyst, okay, that is actually a risk factor for you to develop breast cancer. So bila you develop any sort of lump, let it be a solid lump ke ataupun a cystic lump ke, in a way where I want to say pepejal ke ataupun berair ke, okay, you definitely have to get it checked. Okay, that is something that under uncontrollable risk factors I want to tell you all. Okay, what are the controllable risk factors? Of course, lifestyle. It's definitely a choice. Is smoking a choice? Definitely smoking is a choice. Alcohol, definitely a choice. Physical activity, definitely a choice. Okay, this is something that kita boleh control. Kalau kita pilih untuk tidak merokok, itu adalah pilihan kita lah. Okay, kalau kita pilih untuk tidak minum arak, itu adalah pilihan kita ada juga. And if we choose to be active physically, it is also our own choice. Okay, and hormone replacement kalau wanita yang actually on oral contraceptive therapy ataupun kita panggil pil pencegah, okay, yang itu, this is actually something of course in short term it's okay. Tapi bila ada yang certain ladies yang ambil untuk more than 5 years and 10 years, is actually not healthy. This is something that actually can cause breast cancer. Okay, this is something yang risiko lah. Saya tak boleh nak kata dekat sini, oh confirm ambil hormonal therapy, confirm ambil contraceptive therapy ni dapat breast cancer. No, I don't want to say that. What I want to preach here is that it actually has a risk factor. Okay, ada yang certain people ambil this contraceptive because of their own medical condition. Okay, that is right. Okay, they can go on that pace. But of course, excessive contraceptive yang hormonal treatment ni could also be a risk factor for breast cancer lah. Alright, and having no children, okay, it also a proven risk factor. Okay, we have studies dekat Malaysia, dekat UK, dekat US di mana kalau kalau wanita yang tidak ada anak adalah satu risiko untuk develop breast cancer lah. And of course breastfeeding history. Di sini breastfeeding maksudnya kalau wanita yang ada yang dah lepas deliver, those who actually don't breastfeed actually have a risk factor of developing breast cancer. Okay, that's why kita always encourage women yang lepas beranak tu, kita actually encourage them to breastfeed. When bila menyusu badan ni memang ada mengurangkan risiko untuk dapat breast cancer lah. Alright, so that's for the risk factors. Okay, so we have talked about this, and of course, I'm very sure daripada sekolah rendah, sekolah menengah, college, university, wherever you go, people are always preaching about balanced diet. Okay, what is balanced diet? Of course, try to reduce your sugar intake, salt intake. all that kicap-kicap, sambal-sambal, okay, try to reduce that, okay. Try to memperbanyakkan lagi sayuran, buah-buahan, and also if you're taking a quarter plate of rice, please take another quarter plate of protein. Protein tu boleh jadi telur, ayam ke, ikan ke, okay, that is something healthy, and another half portion of your plate should be filled with these vegetables and also fruits. Okay, this is considered healthy lah. Okay, I'm very sure all of you have heard about it many times. So that is one. And of course, quit smoking. Kenapa smoking? Smoking ni bukan sahaja cause lung cancer. Saya nak bagi tahu dekat sini, ramai sangat rasa yang smoking ni hanya cause breast cancer. No, smoking causes 15 other different type of cancer as well. Okay, it's actually a known risk factor to develop cancer. And of course, alcohol. Janganlah ada orang yang datang tanya saya, doktor, kalau minum 200 ml arak untuk 1 tahun boleh tak? And then another person come and ask me 12 liter of arak boleh tak? Okay, minum macam mana pun risiko tu memang ada lah. Okay, even in the US and UK, alcohol is considered class 1 carcinogen. That means class 1 of di mana dia boleh develop, ada risiko untuk develop cancer. Okay, not especially breast cancer sahaja, but any sort of cancer. Alright, and of course being active is very good lah. Okay, you keep your heart pumping, your blood circulation is good, and that is actually something that it would reduce the risk of developing any sorts of cancer. Alright. Okay, so what are the sign and symptoms? Okay, symptoms adalah something yang patient boleh bagi tahu dekat doktor. Okay, maksudnya doktor saya penat. Okay, itu adalah hanya patient yang boleh bagi tahu, pesakit yang boleh bagi tahu. Doktor tak nampak penat tu. Okay, kalau you rasa you tak ada appetite nak makan, okay, that is something yang patient will bagi tahu. As the doctor, we can't see whether you have lost your appetite or not. Okay, these are symptoms. That means something that the patient tells us. What are signs? Something that I can see, the doctor can see. Like for example, if you have a bleeding nose, okay, that is something doktor boleh nampak. If you have a swelling, ada some discharge, that is something yang doktor boleh nampak. Okay, this is what I want to differentiate between symptom and signs. So what are the symptom and sign of breast cancer? Okay, kita boleh nampak dekat sini, symptom satu adalah palpable swelling over the breast. Palpable swelling, that means ada satu tempat di mana bengkak dekat payudara, and it is something yang kita boleh rasa. Okay, patient sendiri pun boleh rasa, doktor pun boleh rasa. Okay, that is something. Okay, and about breast pain, okay, sakit, memang dia akan complain sakit lah. And also ada nipple discharge. Nipple discharge ni memang dia akan keluar air tak semestinya susu, boleh jadi yellowish discharge and also bloody discharge juga. Okay. And about signs. Signs adalah something that yang healthcare personnel, nurse ke doktor ke yang boleh rasa, di mana dia ada hard atau fixed swelling over the breast, and ada asymmetrical thickening lah, ada skin punya changes, dia punya colour bertukar warna, boleh nampak dekat gambar rajah ni, kita boleh nampak there's difference in colour of the breast, and also some ladies will actually develop armpit swelling yang sangat obvious. Okay, dia punya dekat bawah ketiak tu memang ada ketulan yang sangat besar. Alright, that is something that we can see also. And I want to actually explain macam mana kita nak perbezakan, okay, this sign and symptoms. Okay, kalau you have some symptoms of the following that I'm going to say, you can actually go and get a screening done. Okay, macam mana saya nak explain? Saya nak gunakan lemon. Okay, so it is very important that you know your lemons. Okay, di sini what I want to break is that I want to break this myth of male doctors talking about lemons and talking about breast and all that. So it's very important for you to understand. Okay, based on lemons, apa yang you boleh faham di sini adalah, kalau you tengah nampak gambar rajah di sini. Okay, so you have one where you have thickened area dekat sini. Kita boleh nampak satu tempat tu sahaja yang rasa tebal dekat situ. Okay, and ada juga some people have a dimple. Okay, some have a dimple di mana dia nampak macam a depression area, and some of the nipple crust. Okay, dekat nipple crust tu dia bertukar warna, dia tak normal pinkish ke purplish ke, it changes into brownish color. It's something that you have to see as well. And of course suddenly your lemon becomes reddish atau dia jadi panas. Okay, itu adalah some of the signs and symptoms that you have to watch out as well. And of course macam saya cerita tadi, any discharge, unexpected fluid, boleh yellowish ke, putih ke, ataupun merah darah ke, okay, it's something that you have to take caution as well. Okay, and this is especially for all the women out there. Please take attention on this. Okay, and also skin source. Sering kali je dapat luka dekat breast area, and then pakai cream apa pun dia keep coming back, keep coming back. Okay, this is something that you have to take into a serious action as well. And of course, a hard lump. Tiba-tiba rasa satu tempat tu keras, tapi satu tempat tu lembut. Okay, that is also something that you have to monitor as well. And of course, kita ada panggil orange peel skin. Orange peel skin ni, okay, if you notice, it's something yang bila kita nampak buah orange ni, dia ada macam depression, dia macam waffle appearance, okay. That is something that mungkin ada changes towards breast cancer juga. And of course, kalau nampak ada new shape, completely new shape, ada ketulan yang berbeza, and your entire symmetry of your breast bertukar tu is also something that you have to look into as well. And if you notice that your nipples, dekat nipple tu, kalau dia dah sunken, that is something that you have to take, you have to look into seriously as well. And bila dia berurat, okay, there are some women who think that bila dia growing vein, bila dia berurat tu adalah sangat normal. Okay, that is actually not normal. That is something that you have to, go and get a screening done. And of course, kalau ada satu bump, tiba-tiba je ada satu bump, tu memang something that you have to go get yourself checked as well lah. Okay, so these are something that I want all of you to understand. Okay, know your lemons. Alright, know your lemons. This is one of the take-home message hari ni. Alright. Okay, so moving on. So how do you do a breast self-examination? Kita panggil BSE. Okay, breast self-examination adalah untuk para wanita. Okay, bukan saja para wanita. Okay, untuk kalangan lelaki juga. Okay, untuk kalangan lelaki, if you feel that is something, some difference in your chest or your breast, it's always good for you to go and get a checkup done. I will definitely talk about how men can do their screening later. Okay, but I will actually focus on women first lah. Okay, so for women, how to do your breast self-examination? Do it once a month. Everyone, please do your breast self-examination sekali sebulan. Okay, the best time is actually after your period. Seminggu selepas hari last datang haid. Okay, and then how do you do it? Is that you stand in front of a mirror. You tengok at the mirror whether your breast it looks symmetrical atau tak. Takut satu adalah sagging, something looks a bit off, the shape is a bit different, ataupun you see some color changes and all like that. Okay, when you look in the mirror, you can see the difference. Okay, it's actually something yang kita rasa macam biasa je doktor ni nak bagi tahu. No, some women actually tend to overlook this. Okay, these are something that you have to give attention to. All right, and also satu lagi yang I want to focus is that touching all portion of your breast. Okay, so you can divide your breast into empat, where you have your left and your right and your up and your down. So there is right up, right down, left up, left down. Okay, so how you can do is that you can actually, kalau you rasa selesa berdiri depan cermin, you nak check, boleh, tak ada masalah. Tapi kalau you rasa selesa while you're lying down, you want to check your breast also, no problem. Okay, as long as you check all portions of your breast lah, up, down and left, right. Okay, and also very important, kena check di bawah ketiak juga. You have to check your underarm and also dekat sternum area. Okay, sternum area juga boleh develop lumps. Okay, some women actually tend to miss out this. Okay, some lumps actually develop at the sternal area. Alright, and also most importantly, start feeling for any lumps or masses lah. You kena more, when you check your chest or breast, you have to be more focused on your idea is that you nak cari something. Okay, you nak cari something. If you don't feel anything, it's okay lah. Tapi kalau you rasa something, then you have to go and get yourself screened. Okay. Alright, so what is a screening and diagnostic method yang proven dekat Malaysia? Okay, yang sangat-sangat ada. Alright, so one, of course, we have talked about self-screening, diri sendiri yang kita check diri sendiri to do the breast self-examination. Okay, once you have, kita rasa, okay, something is wrong, we have to get ourselves checked. So what are the imaging that is available in Malaysia? Of course, mammogram is an x-ray of the breast lah. Okay, that is the most simple one and the most available that kita ada dekat Malaysia. Alright, later I will go through a chart on we see which one is more effective, which one is more cost friendly and all that. And of course, MRI of your breast is also something yang very significant, di mana dia boleh dapat detect the exact location and get a detailed picture. But of course, it's very very cost tak cost friendly lah. Alright. And also clinical breast examination adalah something yang mana-mana doktor ataupun other healthcare professional boleh buat, di mana mereka boleh dapat detect some of the lumps and all that. Okay. And also thermography is actually a special camera that senses heat through the and actually will record the temperature of your breast and try to detect if there's anything growing in your breast. Okay, that is something that is available in Malaysia as well. Okay. So what is the differences between screening and diagnosis? Okay, seringkali kita mesti dengar benda ni. Orang kita akan panggil pasal, we'll talk about saringan kesihatan lah, and then ada yang nak buat diagnostic test lah. So apa perbezaan? Screening adalah di mana kita tak memilih orang. Kita tak pergi tanya, oh you ada this symptom ke tak, you ada this sign ke tak. We just take the entire population. Macam for example, saya pergi dekat taman Titi Wangsa, and then I ask everyone there to screen themselves. Okay, all the ladies there to screen themselves. That is screening, di mana kita nak tengok potential of the disease ada ke tak. Kita tak nak pergi cari the cancer there. Alright. If diagnosis is different, orang itu sendiri ada symptom and dia nak actually tahu, dia nak try to establish ada any diagnosis ke tak. Alright, so that is the difference you have to understand between screening and diagnosis. Okay, screening everyone should do, and diagnosis is a must thing for anyone with symptoms. Okay. Alright, so screening and diagnostic method yang kita ada 4 di sini: self breast examination, clinical breast examination, mammogram and ultrasound. Okay, so kalau kita tengok self breast examination, of course lah cost friendly. Okay, kita guna tangan sendiri je kan. Okay, tak ada cost di situ. And availability, kalau diri sendiri tu ada rasa nak check, okay, bolehlah check. Okay, availability is always there. Tapi effective ke tak? Of course, that is something that we would say definitely not effective lah. Okay, just self breast examination alone would not actually give you a reassurance yang you did not develop any lumps or any breast cancer. Okay, how about clinical breast examination? Of course, benda yang sama, cost effective, and then availability. Mana-mana healthcare personnel di Malaysia, di mana-mana klinik atau hospital can check you. But is it effective? We will say 50-50. Okay, mungkin the doctor can try to be more specific and try to attempt to find and identify the lump. But can all doctors be able to identify? Can they do it just by breast examination? Memang kita tak boleh nak janji lah. Okay, and let's talk about mammogram. Mammogram, adakah dia cost effective? Kalau tanya dekat saya, memang tak lah. Average mammogram will cost you RM250 to RM300. Okay, it's not really cost effective, tapi availability memang banyak. Banyak klinik di swasta and klinik kesihatan Malaysia ada this mammogram machine, and dia punya effectiveness memang adalah. We can definitely find if there's anything wrong. We can actually diagnose you. Okay, we can diagnose you with maybe a normal neoplastic disease macam kita cerita tadi, a normal lump ataupun cancer. We can definitely diagnose that. And how about breast ultrasound? Kalau compare dengan mammogram, breast ultrasound is a bit more cheaper, and it's a bit more available as well, and also effective lah. Tapi janji, this mammogram and breast ultrasound is actually done by someone who's very very well trained. Kita panggil sonographer ataupun radiologist, and they themselves yang check for the lumps, and they themselves give the report. Okay, that is something yang more valid lah, and kita panggil lebih effective. Alright, so this is something that I want everyone to understand today. Okay, alright, so bila kita screening for breast cancer, macam manakah cara-caranya? Okay, cara-caranya, first of all, of course, you do your self breast examination. Okay, you check yourself. Okay, you start there, you try to find, do you have anything? Ada apa-apa ke tak? Okay, kalau kita rasa ada lump, ada ketulan, okay, go tell a doctor. Okay, go to a clinic, go approach a doctor, and then tell them, they would actually go on with the other testing. Kalau let's say tak ada symptom, okay, no symptom, tak apa, you can always get yourself screened. Who to screen and how to screen? Okay, we always encourage women above the age of 40 to do a biannual checkup or screening for mammogram. That means 2 tahun sekali kena buat mammogram. Anyone below the age of 40, we don't really encourage unless ada family history. Boleh start checking from the age of 30 lah. Okay, kalau tak ada family history, any Malaysian woman above the age of 40 up until 70, kita actually encourage to go do mammogram, routine mammogram lah. Anyone above the age of 50 or 60, kita actually suggest to go for at least 3 years once. Okay, 3 tahun sekali kita akan minta pergi buat this mammogram atau ultrasound lah. Okay, so kalau ada simptom, Okay, do a self-examination, go tell a doctor, and then you will do a mammogram or ultrasound. Okay, kalau tak ada symptom, go do have a mammogram ataupun a ultrasound. Okay, kalau there is a specific finding, okay, kalau you rasa tak, you're not happy with it, okay, with the mammogram result or the ultrasound result, you can always go for another opinion with an MRI ataupun biopsy. Apakah itu biopsy? Biopsy is where when a doctor takes a sample of tissue from your breast, okay, and send it to the lab. And bila kita hantar dekat lab, kita akan dapat tahu adakah ini sel biasa ataupun adakah ini sel cancer. Okay, this is something that we can actually define lah. Okay, these are the methods that we can actually define. So, apakah kita punya key home message hari ini adalah any women above the age of 40, you know, definitely you have to do a screening, which is mammogram atau ultrasound, 2 years once, and anyone above the age 60, 3 years once. Okay, kalau ada family history, you can start as early as the age of 20. And of course, we definitely encourage anyone with family history from 30 years onwards to do an annual checkup. Okay, it's not dangerous. Okay, mammogram ini adalah radiation yang sangat berkurangan. Okay, it's not dangerous, and you can of course definitely get it done anywhere lah. Okay, and especially dekat NCS pun, you know, in the Pink October month, kita bagi free mammogram, kita ada juga yang breast ultrasound yang kita bagi free, definitely for those ladies above the age 40 up until 60. You know, we always encourage them to come to us and get themselves screened. All right. Okay, so if you are diagnosed with breast cancer, or if your family member atau kawan diagnosed with breast cancer, this is not the end of your life. Okay, that is something that I want you all to understand. Even dekat NCSM, okay, in our society, we have a lot of women who have been, diagnosed with breast cancer, and they are breast cancer survivors who are working with us completely, completely back to normal, and they have a very good quality of life. Okay, so what you have to do once you are diagnosed with breast cancer is that get your treatment options right. Okay, kalau you have you have a few options here. One is of course surgery, radiation therapy, chemotherapy, hormone therapy, and targeted therapy. Apakah itu surgery? You can actually buang itu ketulan ataupun you buang the entire payudara, and of course you can do a sentinel node biopsy. That means just remove a little bit of your lymph nodes and also a little bit of your lump. Okay, and what is radiation therapy? Dia adalah targeted high power beam energy macam X-ray and protons, and dia akan target dekat cancer cell tu untuk matikan cancer cell tu. Itu adalah radiation therapy. Apakah chemotherapy? Dia adalah drugs yang boleh masuk in your dekat your veins, in which where these are actually done for certain women to actually shrunk the size of the cancer. Okay, some women actually will go through chemotherapy. Biasa yang kita dengar 6 cycle, 12 cycle. Okay, that is case to case basis. Okay, but what is chemotherapy is that it's a medication that you actually masuk through your veins, and dia akan go and shrinken and destroy the fast growing cells. Okay, once it destroys the cell and it reduce the size, a surgery will be done to remove the lump. Okay. And of course, hormonal therapy adalah selepas semua surgery, radiation and chemotherapy, kita akan ada hormonal therapy for up to 5 years so that your body has a more balanced hormones lah. And targeted therapy adalah some drug treatments that actually be more specific to attack these cancer cells. Alright, so what I want you all to understand is that you have a very good treatment option dekat Malaysia. Kita punya medical availability and technology has grown very well, so you don't have to worry if you are diagnosed with cancer. Alright, we have a lot of options in Malaysia. All right, so moving on. Yep, this is the example that I want to show you all. Just now tadi saya ada cerita pasal lumpectomy. Lumpectomy adalah di mana kita buang ketulan itu sahaja, and mastectomy adalah bila kita buang the entire payudara lah. So that is mastectomy. Alright, so this is just a picture for you all to understand lah. Okay, so when you detect cancer at an early rate, bila semua orang pergi for regular screening and you do all that, we can detect this cancer at early stage. And what happens is that saya semua nampak dekat gambar rajah ni, the pink color is a 1-year survival rate and the purple color is a 5-year survival rate. Kalau kita dapat detect at an early stage, at stage 1, you see that 97.8% have a very good survival rate over a year and 87.5 over 5 years. Okay, that is actually an excellent quality of life there. And if you see while the stage actually grows, stage 2, stage 3, stage 4, if you look at stage 4, dia punya survival rate untuk 1 tahun adalah 66% sahaja, dan dia punya 5-year survival rate is only 23%. Okay, so this is something that I want everyone here to understand today, that if you get yourself detected for cancer at an early stage, you can definitely have a higher survival rate. Okay, the longer you wait, the lesser the chance of an effective treatment. Please understand that. So don't wait for it. If you have a suspicion of anything, any lump or whatever symptom, just go for a screening. All right. Okay, so how do you protect yourself and your loved one against cancer? Macam saya cerita tadi, okay, salah satu cara adalah tolonglah berhenti merokok. Okay, you're not only harming yourself, but you're also harming your loved ones. You're harming the people around you. You are actually creating a lot of second-hand smokers who are actually also developing risk of developing another 15 different type of cancers. All right, so that is something that you can do, to protect yourself, and also of course ask the people you love to reduce the alcohol consumption, and of course avoid excessive sun exposure. Kalau yang dah tahu dia akan ada banyak exposure under the sun, of course there's a lot of products available. Please use your sunblocks. Sun punya exposure juga is another type of radiation. Okay, it is also another risk of developing cancer. All right. Okay, so moving on, how do you protect yourself? Of course, healthy eating, maintain a healthy weight, regular exercise, and of course, kalau cancer macam for example, cervical cancer, you can of course protect yourself by taking regular caution macam take vaccination and all that. Okay, this is how you protect yourself. Okay. So that is actually the end of my sharing session with all of you. Okay, so I would actually open up for a Q&A session. We have about 4 questions here. Okay, so let's look through one by one. So number one is actually by a patient where, hi doctor, thanks for the sharing session. I would like to know when is the right time for early precaution. When should we initiate a screening? Okay, so for that question, how I would like to answer is that so screening ni memang tak ada right time. Okay, if you have symptom, kalau ada symptom, terus pergi je buat screening. Okay, that is one thing. Tapi kalau tak ada symptom, anyone with family history, start your screening at the age of 30 years old. Okay, kalau tak ada family history, anyone above the age of 40, just get yourself screened annually or biannually. All right. Okay, that is one. So moving on to the next question. Okay, what are the basic education or knowledge post-mastectomy patients should be aware of? Okay, so what are the basic education that they should know is that lepas buat mastectomy, okay, lepas kita dah buang payudara tu, what patients should be aware is that they should know that that's not the end of the world. You have a lot of aesthetic procedure that you can do to actually retrieve back the size of your breast and all that, because a lot of people actually rasa dia akan affect dia punya appearance and all that. They should know that we can actually try to do another aesthetic procedure to retain back the shape of your breast. Okay, that is something that every post mastectomy patient should know. And also what this post mastectomy patient should know is that they also have a chance of developing cancer in another 5 years. Okay, they have a chance of remission. So what they should know is that they should always go for regular screening. Of course, I know they will be doing this mammogram and breast ultrasound, so they should actually go up for their regular screening lah. Okay, these are the basic things that they should know. All right, so next question we would see here is that ada wanita yang flat chested, adakah masih boleh mendapat kanser payudara jika tisu atau lemak payudara kurang berbanding dengan wanita lain? Yes, this is definitely something that I want every woman out there to know. Regardless of the shape of your breast, you can definitely get yourself checked. Okay, so and also you can definitely get chance to develop breast cancer. I mean even lelaki yang tak ada breast tissue pun boleh develop breast cancer. So apatah lagi wanita yang actually have all those hormones and risk factors to develop breast cancer, definitely they have chance to develop breast cancer. So please don't think that you don't have the risk. If you are actually flat chested and you're still above the age of 40, ada family history, definitely please follow my advice and go for regular checkup. All right. And also, how about our last question is that, doktor, kalau dah buang ketulan, adakah berisiko untuk dapat kanser? Alright, so bila dah buang ketulan ini, kita ada risiko juga untuk dapat kanser. Okay, once you are already thrown the lump, the chances for you to develop the cancer again is actually about 30 to 40%. Alright, but this 30 to 40%, That's why kita always encourage all this, patients that actually been diagnosed with breast cancer, lepas kita dah buat mastectomy ke atau lumpectomy ke, kita always suruh dia orang datang for yearly screening. Okay, we are actually worried that they might develop another cancer, not necessarily dekat breast sahaja, can be at other parts of your body. So that's why you have to be very compliant towards your chemotherapy, towards your radiotherapy, and so on. All right. Okay, so I think, all right, so we have a last question here. What is the real side effect of chemotherapy and radiotherapy? So there's no exact thing that we want to say the real side effect. Okay, so the common side effects that patient would actually see, get through chemotherapy, is that you will always see they have this pigmentation and then they have this hair fall. Tapi apa yang saya nak bagi tahu is that those are actually side effects of the drug. Okay, bila drug itu dah proses keluar daripada your badan within the span of, let's say, 3 months to 6 months, once you have recovered from the chemotherapy, you can actually grow back your hair and your pigmentation will actually improve. Okay, this is not a permanent side effect, it's just a temporary side effect. That's similar to chemotherapy and radiotherapy. Both will also have these chances to develop a hair fall and all that. Okay. All right, so I think, oh wait, okay. So hello doctor, as doctor had mentioned earlier that there is a free screening for breast cancer in October. May I know if we can walk in for screening or need to have a referral letter? Okay, that's a very good question there. Okay, so dekat NCSM, dekat National Cancer Society at our headquarters in KL, dekat dengan Hospital Kuala Lumpur je, okay, there we actually have free breast cancer screening. Di mana in the month of October, we have also extended up to mid of November. You can always call us to our clinic, to our cancer health screening clinic, and actually make an appointment. Walk-in tu kita don't encourage sebab sometimes we wouldn't know where to slot in you lah. Okay, so we would of course encourage you to call us before and make an appointment. And if there's any other questions regarding this, you can always leave it in the comment box. Our admin will help you address it. Okay. Okay, so I think, all right, so that's the end of our Q&A session. All right, thank you so much for the questions. And of course, I have seen here there's about 12 to 13 questions left that is unanswered. I would definitely answer them after this session, and I will definitely give you all a good feedback about it lah. All right, so just to wrap up today, all right, so what I want you all to understand is that routine screening definitely saves lives. Okay. And what I want to let you all know is that if you have a question about cancer, about yourself ke, atau family ke, friend ke, kawan-kawan ke, you can always call our toll-free line. We have a psychological support where we can actually help you to, redirect your thoughts and your ideas about cancer. All right, that's one. And also, I want to emphasize another thing. Right now, National Cancer Society, we are actively screening women nationwide. Okay, we are actually very much united, and then we have a lot of clinics and hospitals being partnered with us. We have about 33 clinics all over Malaysia, and also about 15 private hospitals all over Malaysia, even including Sabah and Sarawak. We are trying to screen 6,600 women, and we are also trying to make a Malaysian record out of it. Okay, so please do get yourself screened. Okay, not just for the purpose of getting screened, but also just to get yourself more confident about it. If you will know more about it. Okay, please encourage your family members to get themselves screened as well. All right. And if you have any questions about this breast screening around Malaysia, you can always contact us. You can email to me or also to Mr. Sunway, and also contact us at this contact number. All right. So before I wrap up the session, I just want to inform you all something. Okay, this is actually specific for those penonton Mandarin and also penonton Tamil. Okay, I want to let you all know there will be another session about breast cancer awareness. One will be a Tamil session that will be conducted on 30th October. Okay, and also another session in Mandarin that will be conducted on 31st October. Okay, so allow me to speak a little bit in Tamil. Okay, அனைவருக்கும் வணக்கம். Okay, so Tamil தமிழ்ல உங்களுக்கு மார்பக புற்றுநோய் பத்தி நிறைய தெரியணும் அப்படின்னு நினைச்சீங்கன்னா 30ஆம் தேதி அக்டோபர் மாதம் அடுத்த திங்கட்கிழமை வந்து இதே டைம்ல டாக்டர் துர்கா தேவியோட நம்மளுக்கு வந்து ஒரு செஷன் இருக்கு. So with that you can actually ask more questions in Tamil if you're comfortable in that. And also for the Mandarin speakers, 相见已不了解如爱 okay 请留守我们以立贝尔医生在11/3/1日的直播 alright. Okay, so hope to see you all on 30th and 31st October. Thank you so much for being with us today, and tata bye bye from me. All right.